Good morning. Welcome. This is our 7th iteration of a Moda Forum, Moda Minds as we now call it. We always seek to provide some interesting subject that isn't necessarily something that you would hear anyplace else. And I think you'll find that subject this morning. And we had a dinner last night, and I was asked 2 or 3 times why a health insurance company would be interested in this. What's the connection to the environment, to stewardship, to nature, to wilderness, to children, to all of the things about stress and health in our society? Why would we be doing it? And I think if you thought back 10 years ago, you wouldn't think of much of any connection at all. And if you think 10 years from now or even 5 years from now, you would think there's an absolute connection as to why a health insurance company would be interested in exploring these ideas in a better way to make our children healthier, to create a longer outcome of health such that in this complicated world that we all live, they live a better life and might not have to access the healthcare system in the way which they might otherwise do it. So it's an interesting subject. We've got some great speakers this morning, and I think that you're going to enjoy it very much. I'm looking forward to it as well. So I'm Robert Godey. I'm the CEO of our joint enterprise called Moda Health. And I have the pleasure now of introducing the president of Moda Health, Dr. William Johnson, who's going to introduce our speakers and have a few comments.
Thank you, Robert. And I also want to thank all of you for joining us here today. As Robert mentioned, we launched this as the Moda Forum, and we recently rebranded this event the Moda Minds. Meaningful ideas in new directions. The goal is really to catalyze and inform and start the conversation around healthcare in Oregon. How do we improve it? How do we change it? How do we impact it? What can we do with it? In recent years, we've actually hosted White House fellows, CEOs, renowned surgeons, elected officials, policy experts, and even healthcare futurists. Our guest speakers today are equally varied and also equally accomplished. This year, Moda Minds, we're going to hit the pause button. We're going to hit the pause button on this relentless debate around healthcare reform. We talk about this all the time. But instead, we're going to focus on the complex matrix of the interlocking factors that actually impact the health of individuals and also the health of communities. You know, it's interesting to note that if we think about access to and use of healthcare services, it actually has less of an impact on outcome than the social determinants of health. These include our social environment, our economic environment, physical environment, and also our individual characteristics and behaviors. It is no longer a secret that 5% of the healthcare consumers drive 50% of the $3 trillion healthcare spend. It's also no longer a secret that actually effectively managing or addressing the needs of these patients must go far beyond coordinated care. So we have to think about it from inside really to outside. And that's what we're going to focus on this morning. We must assist in everything from better housing, better nutrition, better access to education, to opportunity, and also to recreation. And yes, nature. Researchers have discovered that this sense of well-being that we get from natural environments have reflected and increased and impacted health benefits among tied to multiple diseases such as arthritis, asthma, cancer, and also diabetes and heart disease. A growing body of evidence also indicates that protecting and restoring nature for all ages, for all socioeconomic backgrounds, and those individuals with all abilities have a significant impact on public health. These include obesity, social isolation, depression, and of course, stress. Stress now is understood to be a major factor in the development of a wide range of illnesses. Spending time in nature is one of the most effective ways to actually reduce and relieve stress. By utilizing elements of the green world, stress-related illnesses can be more effectively managed and prevented, and thereby potentially reducing healthcare costs. Ensuring that everyone has access to nature is important to our society as a whole. it should not be surprising to learn that traditionally underserved communities are most likely to not have access to biodiversity, natural landscapes, gardens, and parks. Depriving rural communities of positive health benefits associated with nature is increasingly recognized as not just a public health issue, but also a social justice issue. So the challenges are great, but perhaps the mounting evidence that the dose of nature is good for health will contribute to the preservation as well as the maintenance of the natural environment and improve quality of life, overall well-being, reduction in healthcare costs, and perhaps even an additional factor in improving health outcomes. I like to call this green therapy versus gene therapy. Our guest today will provide compelling commentary, provocative perspectives and insights, and how best to tackle this issue. So let's get started on our journey creating healthier communities. I'd like to bring to the stage Dr. Timothy Beebe, who is our first guest. Dr. Beebe is the Teresa Hines Professor of Sustainable Communities at the University of Virginia, where he has taught for the last 25 years. He wrote a book, Biophilic Cities, that sparked a global movement advancing the notion that humans are hardwired to need connections to the natural world. Dr. Beebe says that in order to be healthy, we need to touch and be touched by nature. Much of his work focuses on the subject of sustainable communities, on ways that cities can become not just more livable, but more equitable and also healthier places. He is the author and co-author of more than 15 books on what he calls biourbanism and green urbanism. Please welcome to the stage the man world-renowned as the Pied Piper of biodiversity.
Thank you so much. Dr. Johnson made a compelling case already and essentially made the argument I was going to make. The power of nature. Pied Piper of biophilic. I like that. So I've got about a half an hour or so, and I have probably too many slides, but I'll try to get through them, and I'm going to go pretty fast. But I want to basically introduce you to this idea of what biophilic cities is, or what they could be. From a more of a health and flourishing point of view. So I am an urban planner, teach in urban planning department at the School of Architecture, University of Virginia. So we're very much thinking about the design of things and the design of places. And a lot of us are worried, as we should be, about sustainability, about climate resilience. We're thinking about what is the design of cities that will best mitigate and adapt to that new setting. We argue that we want compact and dense cities. We want to create cities that allow people to bicycle and walk, places like Portland. And we want a shift to renewable energy. We want green buildings. We want all of those things, compactness and density. But we also know that we need that nature. And the premise really behind our work is that nature is not something optional. It's absolutely essential to leading a healthy, happy, and meaningful life. That's the crux of the matter. Can we have cities in nature? We have to have cities in nature. Can we have density and compactness and also have nature? Yes. So take the question mark away from that slide. This is a beautiful green, one of Patrick Blanc's beautiful green walls in Paris, and a definition of biophilia. So I'm often giving assignments to audiences, and one of them is that you have to become familiar with the word biophilia. You have to use it in casual conversation at some point today, and maybe multiple times. That would be even better. We have to give a lot of credit to Ed Wilson, E.O. Wilson at Harvard. He wasn't the first person to use the term biophilia, but he's really coined it in the way that we mean it. This innate connection to the natural world, this hardwired relationship that we've co-evolved with nature. So it's not surprising that we are happiest and healthiest, and we are experiencing that lesser stress when we have nature all around us. As another shot of Ed Wilson. The human species has grown up in nature. So this idea that we've co-evolved with the natural world. And we have this remarkable body of growing evidence, especially in the last 5 to 10 years. And we could spend the whole day talking about it. And my friends in medicine and other places will question the causality, the kind of causal proof of it. It's more about association, more about relationships, but it's pretty compelling to me. So I just wanted to give you a little sample of some of this evidence. This is a study just published in Bioscience from the UK showing that in neighborhoods that have more nature, where you're likely to see trees, to see birds, to hear bird song, levels of depression, anxiety, and stress will be much lower. And if you look around, just the last 2 weeks, it's been pretty remarkable to see. There's just a little sampling, Journal of Adolescent Health, actually a big study from the Public Health School at Harvard showing, again, the relationship between depression and nature. The more nature, the less depression you're going to see. About 2 weeks ago, a study in Nature from New Zealand showing the reduction in childhood asthma in neighborhoods that have more nature, more greenery. Even schizophrenia, less prevalent. This is a study coming out of Norway. So the body of evidence is pretty compelling, and we know it affects the quality of our lives, and we know that we want to create places where it's possible and where we can nudge residents to be outside. This is an older study actually from the UK, a nonprofit called Mind. They did a really interesting study comparing the effects of a walk in nature versus a walk in a shopping mall. And we want everyone to be physically active. We know that's really important for health, but much greater impact if we can get people outside experiencing nature. And that's essentially what this study showed. You can't see this very well, but at the end of that walk in nature, the participants showed reductions in depression, anger, tension, confusion, fatigue, and an increase in vigor. And the results from the walk in the shopping mall are almost the opposite of that. And we know, actually, that the more greenery, the more nature we have in cities, the more likely we will be outside, and more likely we are to be walking in those neighborhoods. So there's a really important health connection here. Many of you know about the concept of forest bathing that's come out of Japan, along a series of studies that show after you walk through a forest, and you think about the experiences of walking in a forest, the sights, the sounds, the beauty, the color, the dappled light. Not a big surprise that the Japanese find that at the end of that walk, reductions in stress hormone levels, that walk in nature boosts your immune system. And they're so convinced that they've set up a network of forest bathing therapy stations around the country. And the idea has now made its way to the U.S., and we're seeing forest bathing taking place in lots of parts of the country. So just a little bit of the evidence. We know the remarkable healing power of nature in cities. A whole bunch of studies that show a relationship between tree planting and crime reduction. This is a study actually coming out of the University of Pennsylvania where they compared neighborhoods where they planted trees on vacant lots with those where that didn't happen. And again, not a big surprise. They found reductions in gun assaults in those neighborhoods that were greened. And the vacant lot greening associated with residents reporting less stress and again, more exercise. So my message is, I would argue that if not the single most important thing you can do, one of the really important things to do to affect health is to invest in nature in cities. And we have a lot of health challenges connected with changes in our climate, right? Hotter cities, East Coast cities especially, summer highs are going to go way up. That tree planting, that investment in nature does lots of things for us, including lowering temperatures. This is my hometown of Charlottesville, Virginia, our pedestrian mall. For a long time I was monitoring temperatures during summer, and it's about 10 degrees cooler under those trees than it is in almost any other part of the city. And that affects our health, and it also affects the wanting to be outside, and it affects the quality of experiencing these sort of places. If we look globally, of course, cities have huge problems, and cities like New Delhi and Beijing have huge air quality problems. I think the number is something like 7 million deaths per year from air pollution, particulate matter especially. And we know, this is a Nature Conservancy study on the left, that it is a very cost-effective thing to do to invest in planting trees. And that it can have a huge impact, a huge health impact, a huge impact in reducing mortality from air pollution. So with nature, lower depression, lower levels of stress, improved mood, increased happiness, increased physical activity, lower crime, reductions in social isolation, a huge effect on health there. All of these things, I won't go through them, and some of the evidence that in the presence of nature we are more likely to be generous, we're more likely to be cooperative, we're more likely to think longer term. So we're actually better human beings when we have nature around us. Like the last one here, increased laughter and joy. That would be a good city. So for me, the word flourishing really captures all of this. It's about health, but it's also about living a connected, meaningful life. And that's what nature can do for us. So again, it's not something optional. So we have connected this idea of biophilia with the design of cities. So there's a lot of work around biophilic design, has been for a couple of decades, and it's mostly about how you bring natural daylight into buildings, how you bring living nature inside. We have a lot of evidence about increased worker productivity, for example, when we bring those features, bring those elements into work environments or schools. We're arguing that we want cities where there are lots of biophilic buildings, but it's much more than that. It's the buildings, but it's also the spaces outside the buildings and around the buildings. And it's all of the spaces between the building, the room, the rooftop, and the region, or the bioregion, and all of the scales in between. So our vision of a city is one of immersive nature, where you have that nature everywhere. So these are cities that connect us to nature and connect us to each other. I sometimes talk about buildings plus, or beyond buildings, or beyond parks. We want to think, again, more holistically about nature in a city. The vision of biophilic cities is very much about connections. So it's like my can you hear me okay? It's coming in and out. That we foster those connections to the natural world that help us connect to each other. We also increasingly recognize the important role that cities play in conservation and in biodiversity preservation and protection. We know that cities are harbors for biodiversity, so there's a conservation agenda here as well. And there's also a sort of an ethical agenda. We see biophilic cities as cities that share space with other forms of life, and we've got to figure out, as we are in many cities, how to coexist with other forms of nature and with other forms of life. I'll give you some examples of that in just a minute. So in 2013, we launched a global network of cities, the Biophilic Cities Network. You can find out more about all of this on our website, biophiliccities.org. This slide is a little hard to read and it's a little bit dated, but we have about 20 cities or so in the network now. We're very happy to have Portland in the network. Portland has been a leader and been one of our initial partner cities when we started this network. We have just gotten a Robert Wood Johnson Foundation grant to expand the network, so our goal is to have at least 50 cities by the end of 2 years. So it's gaining traction, and cities around the world are beginning to gravitate to this vision of a natureful city. Many things we're doing in the network, a lot of what we do is capture stories and share them with other cities. We do this in lots of different ways. We have an online journal called Biophilic Cities, and we're about ready to publish our 3rd issue of that. The first 2 are on our webpage if you're interested in. We have developed partnerships with other organizations. This is an image from last spring. We co-organized a Biophilic Cities lecture series with the Smithsonian, a Natural History Museum in Washington. Person on the right is Catherine Warner, who is the sustainability director for the city of St. Louis, and she's been one of our champions. St. Louis is now in our network, and they have a wonderful story to tell. She told it in this lecture at the Smithsonian about the planting of butterfly gardens in that city. So former Mayor Francis Slay actually made this pledge that the city was going to plant a minimum of 250 butterfly gardens by a certain date. Not a pledge that you hear so often, kind of pledge from mayors, right? They're not pledging that. I'd like to see more of that. And he planted one in his own garden and became a big advocate. So the 250 mark, there are now 400 and something butterfly gardens in St. Louis. They're all online on an online map. You can take a look at them. It's a wonderful story and a city doing wonderful things. So we're also telling stories by making films, and our goal is to have at least one film about each of our participating cities. This is an image from a film we made about Singapore. It's a 45-minute or 50-minute film. You can also find it on our webpage. We have a YouTube channel with all the films. Please take a look. It's remarkable what you can do with a little bit of money, and you basically allow folks to tell the story of what they're doing and their projects and their neighborhoods. And that's what we did with Singapore. We've had 100,000 views so far, which isn't much in the realm of Beyonce or Taylor Swift or people like that. We're aspiring to more like 1 million hits, but we're not there quite yet. But it's a very compelling way to tell the stories. We are trying to collect good practice, best practice from these cities. We have a biophilic codes initiative, and actually J.D. Brown, one of our is right here in the second row. If you want to talk later about that, has been been heading that initiative, and he's now our program director for the Biophilic Cities program overall. We need to learn from each other. So these are two examples from San Francisco. They have bird-friendly design requirements now in that city. And they were, actually Portland, many of you know Portland just adopted a mandatory green roof requirement. However, Portland's number 2 in the U.S. San Francisco beat you to it, Mike Hauk over here. So sorry. Wonderful news, though, in Portland. So we need codes, and we need ways to implement these ideas. So I've already said this, but there's wonderful work going on around biophilic design, and it is something that architects and landscape architects and other designers have embraced. And we have wonderful projects. This is one from Washington. Washington, D.C. is now in our Biophilic Cities network. We're very happy about this. And this is the Healy Center at Georgetown, which embodies all of these healthy features. It's all that natural daylight in this building, extensive green walls, natural materials, the connection to the outside world. They designed this building so that you can sit and see the Potomac River, see that connection to nature. But again, it's not just buildings, it's this larger city scale that we need to be thinking about. Given the health focus and the Moda venue today, I thought I would just mention the importance of biophilia and biophilic design in healthcare and health facility design, which is probably the place where it's been most extensively applied. So not uncommon, of course, now to find healing gardens in many hospitals. This is my favorite example, again, from Singapore, KTPH. There's a piece of the Singapore film about this hospital, the most biophilic health care facility I've ever seen. Multiple levels of green roofs, green walls, green window boxes, bringing nature inside the buildings, a waterfall in the center of this courtyard, judging the success of the building by the number of butterflies, the number of species of butterflies and birds that you see, and they're actually keeping track of this. It's really a remarkable story. There's even an urban farm on the rooftop of one of the key buildings there. So they call it a hospital in a garden. And actually, the country of Singapore has now changed their mind from a garden city to Singapore, a city in a garden. And that's really, really capturing the vision that we have for biophilic cities, that we want to live in cities where we have parks, But we have this kind of bifurcated idea that to find the nature, you have to walk down the street to the park. But increasingly, our vision is, let's make the city the park. Like Singapore, let's make the city the garden. Let's make the city the forest. You don't need to visit the forest. You're living in it, and it's all around you. This is an image that shows that. We talk about whole of city. I've already said this. So it's room and rooftop all the way to region or bioregion, and all those levels in between. This is a map of Helsinki. So this is a wonderful city where you can have nature all around you in the center of the city, and then you this connected network of green space, and you can move to progressively larger amounts of nature and end up at old-growth forest at the edge of the city. It's a kind of a city that we want to have. Well, here's my slide. Singapore, city and a garden. So they're doing a number of things to implement this idea. This is a pretty compact, dense city, right? Much of that development, much of the growth of that city is happening in high-rise buildings in a very vertical way. So Singapore, for example, has something called the landscape replacement policy. So when a building is built, it has to replace the nature lost at ground level with nature in the vertical realm. And this is one example, really wonderful hotel called Park Royal. Woha architects, you may have heard about them. They're doing just wonderful work. So it replaces that ground level nature to more than 200%. And it's done in a variety of ways. It's a really, as you can see, a really living building. You walk around this building and it's like a tree. Singapore is really a remarkable story. And the ways in which there is this sort of competition now happening to see which building can be the most biophilic, the most natureful, the most additive in terms of nature. This is a newer building, also a Woha design. It's called Oasia. And they have designed this building so that the facade, the entire facade, is planting space. So they planted 20 species of flowering vines. And they've done it in a way that there's always something blooming. Depending, over the course of the year. So, and by the way, the nature replaced here is 1,100% of the ground level nature. So they're actually adding nature. It's additive. And it's that immersive nature that I've been talking about. So isn't it a wonderful idea that we think about buildings that bloom? That should be a sort of mandatory design standard, I think. We have other examples. Melbourne in Australia, we're hoping they're going to join the network soon. They've just adopted a very progressive, a very ambitious forest plan, urban forest plan that will double their tree canopy coverage by 2040. What's most interesting to me, though, is that they're talking about it not in terms of planting more trees, but rather reimagining themselves as a city in a forest, as I've been saying. It's immersive nature. And they've been engaging the public around this plan in really creative ways. So one thing they've done is they've given each existing tree in Melbourne its own email address. And they've encouraged residents to send a loving email to their favorite tree. This is biophilia, right? And so it's a wildly popular initiative, and the tree will answer back, which is really creative. So this is connection, right? Connection to nature, connection to each other. I don't know how I'm going to do this, actually, but I wanted to make the point that this vision of biophilic cities is multisensory. So we think it's really important to think about, for example, the soundscape. It's not just the visual, not just the ocular, but it's what we're hearing. And so just as a little sampling of that, it's also place fixing, too. Can we play the top bird? I don't have a keyboard here. I didn't think about this. But this is one of my favorite sounds. It's a sound of spring and summer, the wood thrush in eastern U.S. Can we play it? And we have all this evidence now about the therapeutic value of birdsong. It's stress-reducing. It's life-enhancing, really, right? I hear this sound, and it takes me immediately back to my childhood. And I feel my blood pressure going down already. It's just remarkable, and it's place fixing. It's very special to where I live. So it's a very subtle here. Not the volume is probably doesn't need to be too loud. So can we play the second one? So every city will have a different soundscape. Certainly a different natural soundscape, but human soundscape as well. If we could play the second one, we have one city, Fremantle, in Western Australia, has just joined the network. And this is a sound you will hear a lot around Fremantle. It sounds like a crying baby, Australian, like that. And I love this sound, and it's very place fixing. And anyway, we need to be celebrating natural soundscapes. We need to be cataloging them, inventorying them, working to preserve them. That's a lot of what we want in a natureful, biophilic city. At the same time, we need to worry about noise, which has a huge health implication, and it's masking our hearing all these wonderful nature sounds as well. We know from a health point of view that engaging folks, building social capital, building social relationships is really important, getting people outside and interacting. So we think biophilic city is not just a city that can be defined by the presence or absence of nature. It's not just the forest canopy coverage or even the natural soundscape. How much engagement do people have in that city with the nature? Are they outside? Are they enjoying? Are they listening to bird song? Are they able to identify common species of flora and fauna? Are they involved in an urban restoration project? Are they members of a birdwatching club? All those things are just as important. The philia is just as important as the bio. For us, a love of nature, love of city. So Reston in Virginia, Newtown, some of you know about the story of Reston, coming out in the 1970s. They have really made a Herculean effort to get their residents outside and engaged in nature through a variety of mechanisms, butterfly counts, dragonfly counts, bio blitzes, lots of really neat things. And the metric for them is really remarkable. So it's not a large city, but half of the population over the course of a year has been directly involved in some element of nature. That's really remarkable, really impressive. So whole of city, full immersion of nature also means full immersion over the course of your life. So we want you to have that nature, that experience from the very early years of your existence. And Rich Liu is going to talk later about the nature of the Childhood Nature Network, and this is a school we were just talking about just outside Atlanta. And we're making a little film about it, and it's really a remarkably different sort of design for a school. Instead of having an elementary school that's just one building or a school that's one building, you have smaller buildings that have classrooms, and the kids are ready to move around during the course of the day. They have boots when the weather's not so good, and they're out on the trails, and they're taking their math assignments outside, and they're applying science, and growing food. So we think it's a remarkable story, and the number of days that the students miss for health-related reasons is remarkably lower here. At least that's what the initial evidence shows, compared to, say, the Atlanta school system more generally. So full immersion of nature. We look at all the space of the city as opportunities for getting us outside, opportunities to appreciate the nature nearby. We have one city in Costa Rica, Cura de Bat, in our network now, hoping others will, in the San Jose area. This is a wonderful initiative, Ritos Naturbanos. They're envisioning 25-kilometer network of trails along the two major rivers that run through that city. And this idea of wilding cities. We have the chance to convert sterile, hard surface infrastructure in cities to natureful biophilic infrastructure. This is one example from Western Australia, the city of Perth, where they've taken a really conventional water feature, chlorinated water feature, not real inspiring, and they've converted it into essentially a native wetland in the middle of the city. That has all this birds and frogs and remarkable life and sounds associated with it as well. We have a 5-minute film about this, and Josh Byrne, who's a pretty famous designer in Australia, has a TV show on the ABC network there, and he was the primary designer for this project. But there's a 5-minute film on our YouTube channel about it if you're interested. Edmonton, Canada has also been in our network. I want to just, in the time that I have left, I need to, 3 minutes. Not 30, 3 minutes, okay. As I say often, this is the point where the photo essay starts. Just quickly flip. Did you get the 5-second version of the remaining slides? So Edmonton, the story here, a remarkable city that's designing itself around an ecological network, connected ecosystem, so the idea of the wildlife can pass through the city easily. They've just finished their 27th wildlife passage, structures that let animals, big and small, move through the city. The newest chapter is their strategy called Breathe, which has it's a very comprehensive network. It has an ecological element to it. It has a celebratory network, spaces where you would engage in community gathering and community events. And there's a wellness layer as well. So that includes the bicycle network and the trails and things that are part of the green space network that will help you be more healthy. They are also a winter city, so they've developed a winter strategy. How do you get people outside at that time of the year? We want you to be active, physically active and healthy. They have developed this winter strategy, a number of really cool things. In many cities, you have freeways. In Edmonton, you have freezeways. Idea that you should be able to skate from your home to work during those winter months. A remarkable story. Pittsburgh has joined our network as well. These are some of the ways that they are biophilic, connecting residents to the three rivers. They're very proud of their 42% tree canopy coverage there. Mayor Peduto accepting the Biophilic City certificate. Austin, Texas is a whole story. Many of you know about the 1.5 million Mexican free-tailed bats that took up residence under the Congress Avenue Bridge. People come out during the summer months to see the emergence of those bats. Cities as shared habitat. Rich may talk about this, I'm assuming, the Children's Outdoor Bill of Rights. Wonderful work that Austin's doing. And they've developed a nature equity map as a way of guiding their investments in things like their Green School Parks initiative. Richmond, Virginia, a wonderful story. We're hoping they're going to be joining the network soon. The James River, a wild river that runs through this city, Class 4 rapids, heron rookery, bald eagles, a few hundred feet from a very dense city. So this feature of wildness, not wilderness, but wildness is very important to us. Vitoria-Gasteiz, the capital of the Basque Country, wonderful story of their green ring, and they just daylighted a stream that runs right through the center of this city. Oslo, 2/3 of the city is in protected forest. The other third is densifying. Wonderful vision of bringing back to the surface and restoring the 8 major rivers that connect the forest and the fjord in that city. And they have a wonderful network of urban trails to get people outside. Milwaukee, wonderful story of how you take leftover spaces and create places for people to come together and to grow food. Wonderful story of Alice's Garden. They have a municipal program called Homegrown, which is taking vacant lots and combining them and creating pocket parks. And this is one of the first that they've designed, Ezekiel Gillespie Park. San Francisco is a partner city as well. Wonderful work taking small spaces and inserting nature. Many of you know about parklets, taking 2 or 3 on-street parking spaces and creating small parks. This is a few slides that have to do with a very innovative sidewalk landscape permit that they now have. So if you're a resident, you can actually apply to take up some of the pavement in your neighborhood and insert a garden. Wonderful empowerment idea. My last slide, I think. Wellington, New Zealand. Haven't had a chance to talk about that. It's been one of our original 10 partner cities. Wonderful things that they're doing. One of the most impressive is to think about the watery nature around them, the marine nature. So they are developing a vision of blue belts to complement the green belts and to appreciate this remarkable marine biodiversity that exists in that city. Okay, but please do visit biophilic-cities.org. We have a new book out that documents a lot of the things that I've been telling you, with chapters in Wellington and Portland and Victoria, a number of cities that we're working with. So thank you very much. Thanks for listening. I'll stop.
Well, thank you very much, Dr. Beatley. That was exciting, and I will definitely make sure that I use the term biophilia today in conversation. I think that counts as 2, because I added my opening remark, so one more time. Again, can we give Dr. Beatley one more round of applause? So now we'll switch gears for a moment, and we're going to move away from the nature of healthier communities to the practice of developing communities. Our next speaker, Dr. Jim Rickards, led the effort to establish one of Oregon's first coordinated care organizations, pioneering the delivery of integrated value-based care across our state. A radiologist by training, he's the author of a book called Our Health Plan. It's a book that documents how community-governed healthcare can actually work. In 2015, he became the Oregon Health Authority's chief medical officer. He oversaw more than 1 million Oregonians in that role. And also, he has been very instrumental in discussing how social determinants of health have a significant impact on health outcomes, as we mentioned earlier. He is currently the Senior Medical Director here at Moda. Please welcome to the stage Dr. Jim Rickards.
Thank you very much. Let's get out of the way. I'm a biophiliac, so I said it. Well, it all started for me about 15 years ago. I found myself sitting alone in a dark room. I was talking to myself, and I was saying the same things over and over again. And it seemed like no matter how hard I tried, no matter how hard I studied, no matter how often I tried to work with the other physicians in the hospital, it kept happening. And it started to become more and more frustrating over the 15 years of my career as a radiologist. And in many ways, this was completely normal and acceptable. You see, as a radiologist, I typically would spend my days sitting alone in a dark room, talking to myself, dictating medical imaging studies, interpreting them, turning pictures into words, turning CT scans into medical reports. So there was nothing wrong with the fact that I was sitting there talking to myself, but it was the frustration with my medical practice that started to bother me throughout the course of my career. And the reason I was frustrated was interesting. I know a lot of physicians these days suffer from burnout and talk about the frustrating factors of practicing medicine, but the reasons I was frustrated weren't for the typical reasons you usually hear. I wasn't frustrated because of increasing administrative complexity or declining reimbursements. I was frustrated because I felt as if I was getting to know my patients too well. And now you're thinking, well, wait a minute, you're a physician. I mean, damn it, Jim, you're a doctor. You should know your patients well. And I say, well, yeah, that's absolutely true if, say, you're a primary care physician, a family practice doc, or a pediatrician. You should know everything there is to know about your patients. But you see, as a radiologist, I practice medicine a little bit differently. The imaging exams that I help people with literally cost thousands and thousands of dollars and actually expose people to a considerable amount of radiation. So I was challenged because there were a subset of patients, a not insignificant number, who seemed to keep coming back time and time again for repeated imaging studies. And I was challenged to see really any interval change or difference from one study to the next. And oftentimes, I found it difficult to even find anything inside these imaging studies to account for their physical problems or to account for the clinical history they were presenting with. Oftentimes, there was just nothing there. And so I really started to question, well, what is the value of the service I'm delivering? What is the value of the medicine, the medical care we're providing to help these individuals with their health issues? You know, I started to feel as if I wasn't necessarily moving people on to health, but I was just moving them through the healthcare system. And so this was frustrating for me. And I would go home in the evenings and I would talk to my wife about a number of these cases. There was a young man I remember who came in seemingly every week for nearly 20 weeks in a row, every Monday morning at 7 a.m., every time with the worst headache of his life. And we do a whole battery of exams, including a head CT. And they were always negative, fortunately, but it was troubling because I could never figure out, well, why does he always seem to have the worst headache of his life? Or the young girl who would come in by ambulance just every Friday night for about 10 to 15 weeks in a row after calling 911. And she'd come in extreme distress with incredible abdominal pain. And we would do ultrasounds and CT scans. And there was just nothing there to account for the symptoms that she was experiencing. And so I would tell my wife about some of these cases, and it was through those conversations that I learned that some of my patients were actually some of my wife's patients. You see, she is a social worker, and she was practicing in the same town that I was practicing radiology in. And she would see many of the same individuals in her clinic that I would see in the hospital. And it turned out that she had a much clearer view into their lives. She was able to see much better into what was causing their healthcare problems than I could ever see, even with the most high-tech imaging studies. And it was through these conversations that I began to learn about and really experience firsthand how the social determinants of health impact individuals' overall health and can eventually lead them to seek medical care. You know, interestingly, I don't think I finished my formal medical training all that long ago. I completed my fellowship only 10 years ago. But when I think back to medical school and internship and residency and fellowship, I'm stressed to remember a time at which we had a formal lecture or even really talked about the social determinants of health. Now, fortunately, they're gaining popularity and it's somewhat in vogue to talk about the social determinants. But it was really through my firsthand experience in these conversations with my wife and seeing what was happening in our community that I learned about them. And so the whole social determinants of health is this notion that so much of our health is impacted by more than just the medical care we receive. You know, the studies show that only about 10% of our health is determined by the medical care we receive. The vast majority of our health is determined by our behaviors, our environment, our access to transportation, our socioeconomic status, our level of education. And so in many ways, even if I would interpret these CT scans perfectly or my colleagues in the emergency department would deliver great care, individuals would keep coming back because their health was happening out in the community. Their health was happening in their homes, and there was very little that we could do to impact their health in the four walls of the hospital or in the four walls of the clinic. And so while my wife and I would sit over the dinner table and talk about some of these individuals, we were challenged to connect professionally in a more formal fashion. And it wasn't just because I was this radiologist sitting in a dark room talking to myself, but it turns out that all across our community, there were, of course, services and organizations dedicated to helping individuals with all these different determinants of health. We had social services agencies, we had transportation agencies, we had housing departments. So we had a number of individuals providing services to help individuals with all these different determinants of health, but their efforts were siloed. They weren't coordinated. Our community, like many communities, didn't necessarily have a vision for what it meant to have a healthy population. We didn't have a common set of measures to see how we were doing in delivering all types of healthcare services throughout the community. We didn't have one organization to bring all these different providers together to work collaboratively, to coordinate care, to help the entire health of the individuals and our population. You know, it felt to me as if there was a large hole in the social fabric of our community. We had this kind of patchwork quilt of all these different providers, but the patches, they weren't sewn together. And so when we tried to wrap this blanket of care around people, the patches would literally fall apart, and it was just by chance if some happened to land together, such as my wife and I having a conversation. And so this was difficult. So my wife and I would talk then naturally about, well, what can we do about this? What would the solutions be? Well, we didn't have a formal way to go about addressing this. And so what did I do? Well, as any good radiologist, I went in my dark room, I closed the door, and I kept talking to myself. And that's what you do, right? Well, really around the same time I was starting to have these thoughts, the state of Oregon was facing some challenges with its Medicaid population. We had some challenges in regards to funding the program as well as ensuring that quality care was being delivered to our Medicaid members. Many of the challenges our Medicaid program was facing was due to the fact that so many of the problems our Medicaid members were facing weren't medical in nature. They were due to those other things. They were caused by those social determinants of health, substance abuse, access to housing, access to nutritious food. All these issues were driving challenges with our medical payment system and medical delivery system. Now, we all know in the U.S., healthcare is incredibly complex. It's complex in how we deliver services, how we measure performance, and how we pay for care. But in my simple radiologist mind, whenever I think about how we pay for healthcare, I try to keep it very simple. And I say, in this country, there's really only one way we pay for healthcare. And now you're probably thinking, is this guy crazy? Who invited him to Moda Minds? We pay for healthcare in a million different ways. Well, the fact is, we pay for 90% of healthcare in this country using health insurance after the passage of the Affordable Care Act. And even under the current presidential administration, more than 90% of all Americans have health insurance. Now, of course, it gets more complicated because there's multiple different types of health insurance. But even that, I've managed to simplify in my radiologist's mind. And I say there's really only 3 types of health insurance: commercial insurance, Medicare, and Medicaid. It's important to have a good understanding of these different types of insurances for the rest of my talk, so I'm going to briefly go into them. Commercial health insurance, that's probably what most of us have in this room. We receive it typically as a benefit from our employer, or we purchase it on the health insurance exchange. Now, of course, it gets more complicated because there's multiple health insurance companies, health insurance carriers out there. Moda is one of them. We're probably the best, but besides that, there's a lot of other health insurers out there. Medicare, that's another type of health insurance. That's health insurance for individuals 65 years of age and older. If you're 65, you qualify for Medicare. Now, there are other reasons and ways you can acquire Medicare, but that's really the main way you can get it. Medicare is paid for and administered by the federal government. Now, of course, it gets more complicated in that there's Medicare's parts A, B, C, and D. But for our purposes, I think it's fair to say Medicare, 65 and over, paid for by the federal government. Medicaid, that's the last type of health insurance we need to worry about. It unfortunately sounds a lot like Medicare. Why did they do that? Why couldn't they have called it something different? But that's what we're stuck with. And it's unfortunately often confused. But Medicaid is incredibly different than Medicare. Medicaid is insurance for economically disadvantaged individuals. If you don't make a lot of money, only about $13,000 a year annual income as a single individual, you qualify for Medicaid. Medicaid's also different from Medicare in that Medicaid is in part paid for by the federal government and also by the state government. And the Medicaid programs in this country are administered by the state governments. So with that, states have considerable responsibility when it comes to funding and running Medicaid programs, but also considerable flexibility in how they want to administer those programs. So you think back to when I was talking about some of the frustrations I was having, but at the same time we were challenged with our Medicaid program in the state. It was the challenges we were facing around delivering health insurance to the economically disadvantaged individuals in Oregon. And so, typically when states face challenges with their Medicaid population, they'll employ a number of strategies to try to fix mainly the financing of the programs. And none of these strategies typically work that well and don't work in the long term. So states will try to decrease payments to providers. They'll simply decrease reimbursement rates to physicians, to hospitals, to facilities. Well, that typically is not a good long-term solution because what happens is providers simply can't afford to keep their doors open or see Medicaid members. As a result, Medicaid members lose access to care, preventative services aren't delivered, chronic conditions spiral out of control. When individuals finally present, likely to an emergency department, they're much sicker than they would have been if they would have presented earlier and have much higher health care costs. So decreasing provider reimbursement is not a good long-term solution. Another strategy would be to decrease the number of individuals who receive Medicaid benefits, simply decrease the ranks. Well, currently in Oregon, 25% of our state population receives Medicaid benefits. 1 million people. That is a huge number. It's similar across the rest of the U.S., especially the other states that expanded under the ACA. Well, to cut those services from those individuals would be very hard for them as individuals, but also politically very difficult. So decreasing the ranks of the Medicaid members is usually not a good solution to addressing budget shortfalls for Medicaid. The third solution is to limit the number of available services or surgeries, treatments available for Medicaid members. Well, in Oregon, we had a long-standing tradition of using something called the prioritized list, which many of you are probably familiar with. And it was essentially a very transparent, evidence-based way to prioritize the various healthcare services available for Oregonians. To shorten that list any more than it already had been shortened was probably going to be unreasonable and still justify providing meaningful care to our Medicaid members. And additionally, CMS, our federal regulator, was probably not going to approve shortening of that list anymore because we were unique in that we were really the only state that had a list like this and restricted care in this way. So we needed to come up with a fourth path. We needed a way to address those social determinants of health, to address behavioral health, medical care, dental care, to come up with a way to allow our communities to better coordinate care. And so our solution, as probably many of you know, is to create a new model for delivering and paying for Medicaid benefits. And that was to create what's called the coordinated care model, the foundation of which are our coordinated care organizations, or CCOs. The idea would be to create these new healthcare plans, these truly community-governed healthcare plans where local communities would have the ability to govern their healthcare resources and be paid by the state to administer those benefits. And so with that, the idea would be that states would pay each CCO what was called a global budget that the CCO would then need to use to pay for not just medical services, but also behavioral health and dental services, along with other services like non-emergency medical transportation. And the organizations were to have a governing board made up of community leaders involved in healthcare. So local hospital officials, actively practicing physicians, behavioral health providers, local elected officials, officials from the public health department. CCOs were supposed to have a governing arm as well, made up of actual Medicaid members and their families, a governing arm called the Community Advisory Council to give real input from the member perspective. And then finally, CCOs were to have what was called a clinical advisory panel, a governing body made up of providers from the community. And not just physicians, but also pharmacists, dietitians, naturopaths, acupuncturists, etc. Folks who knew the challenges facing the Medicaid members from the provider perspective and could bring those opportunities to one place so they could finally collaborate and work together to develop real solutions. And so I remember sitting in that dark room and hearing about this and thought, wow, this sounds amazing. I have the opportunity to actually develop and help start a community-governed healthcare plan where I could finally work with other providers in the community, like my wife, to come up with real solutions to really make a change. And so I was completely enthralled by this idea, and so were a number of other individuals in my community, as well as individuals across the state. So myself and a number of other community stakeholders came together, formed a coalition, and applied to start one of the first 16 CCOs in Oregon. We were awarded one of the 16 CCO contracts. It was the Yamhill CCO. I worked there for several years before moving on to work for the state. And, you know, to me it was amazing because after starting the CCO, the way providers and the community thought about Medicaid members and the way we addressed services for Medicaid members completely changed almost overnight. I think, you know, one of the most powerful parts of the CCO was to form what were called these clinical advisory panels, and that was the ability to bring together providers to talk about, you know, some of the challenges they were facing. And I remember for almost 2 years in a row, we had these monthly 7 a.m. meetings, and we would have over 50 providers turn out on a regular basis, you know, from all representing all facets of the social determinants of health to talk about the challenges we had. And I think the power of that was that, you know, our community really never had this structure before, and we'd never been given permission to come together and have these conversations. So we're now 5 or 6 years into the CCO model. People often ask me, you know, Jim, is it working? You know, have you seen some change? Have you seen some benefits? And I would say, yeah, you know, I think in many ways our CCO model is working. I think we do truly have community-governed healthcare in this state, at least for the Medicaid population. You know, when we look at success, there's a number of different measurements we can look at. I think one of the biggest signs that shows we're successful is recently the federal government, CMS, reapproved our waiver, and we're going to be able to continue the program for another 5 years, so that's a strong vote of confidence. But, you know, whenever I look at any kind of healthcare transformation or healthcare improvement efforts, I always say there's two main perspectives that you need to take when evaluating them. One is a clinical perspective to look at the quality and the outcomes and the patient experience, and the other is the financial perspective to see, are you really saving money, are you bending the cost curve? Well, when we look at our CCO model from a clinical perspective, there are, again, a number of measures we can look at to see if it's successful. But I think one of the most telling measures is what we've done around primary care. So primary care is really the foundation for all medical care in this country. You know, when you think about going to your doctor or who your doctor is typically a primary care doctor. Well, In Oregon, we're fortunate in that we have this program called the Medical Home Program, in which we recognize primary care clinics if they're super clinics or if they're kind of primary care clinics on steroids. That is, if they offer additional services above and beyond what you might typically find in a primary care clinic. So an example would be a clinic that has team-based care. So you go to see your doctor or you go to the clinic, and it's not just your doctor there, but on staff there might also be a behaviorist or a dietitian or a physical therapist or a clinical pharmacist. So a whole group of individuals that can help you. Well, in Oregon, we have a number of our primary care clinics now that are recognized as medical homes, these super clinics or primary care clinics on steroids. And as that relates to the CCOs, currently more than 90% of all CCO Medicaid members receive care at one of these medical homes. So I think that's truly amazing that we've been able to build this system, this access to care for our members that isn't just providing them with care, but high quality care. And it's really that success from the clinical perspective that I think has led to some of our financial successes as a state. And again, there's a number of different measurements we can look at to see have we been financially successful with this model. But I think, one of the most telling ones and probably the simplest to understand is this number of 3.4%, which many of you are familiar with. And basically what that is that for every year of our state's Medicaid program, the cost increases have not increased by more than 3.4% a year. So really not increasing it much greater than the rate of inflation for Medicaid spending. That's in comparison to what we see in the commercial or the Medicare sectors where the annual cost increases are anywhere from 6 to 8 to 10%. So our ability to organize our communities, increase access to high quality care has now bent the cost curve and resulted in some cost savings. So, there are these high-level metrics we can look to see what our success is, but I think the real successes can be seen in the programs that our communities have been able to develop by being able to come and work together more closely. And, a number of CCOs have innovated in transformative programs. One of the programs I was fortunate to be involved in was called a Community Paramedicine Program. And you remember when I started off talking today, I was talking about these folks that would come into the hospital repeatedly and we would do all these scans on them. Well, the fact was, folks would come in and we could provide the best medical care possible, but again, health happened in the home. So we realized that if we were to truly impact individuals' health, to work on those social determinants of health, we had to get out into the community. We had to get out into people's homes. Well, who better to know individuals who are accessing the emergency department, who are responding to these 911 calls to take them in to the hospital than the paramedics? And so we had some excess capacity with our ambulance system in the county, and our paramedics were willing to go do non-emergent visits. I mean, think about that. Instead of having to call 911 and fly out to someone's house with the sirens blaring, we could now schedule a visit where our paramedics, who already knew these individuals who are accessing the emergency department, who already knew their homes, could be paid to go do a non-emergent visit. And they could go into individuals' homes and do a variety of services. These would be things like medication reconciliation. Oftentimes, these individuals, so-called frequent flyers that come in and out of the medical system, receive multiple medications from multiple physicians, and it's very difficult to organize them and know what to take when. So our paramedics could go out there and simply help organize the medications for individuals. They could also do safety checks, ensure that there is a safe, secure living environment for these folks. They could provide non-emergent medical transportation, help take these individuals to their primary care appointments or to behavioral health care appointments. And so I remember hearing about this program and I thought, well, yeah, I think this could work, but admittedly I was a bit skeptical. Here I was, this radiologist with 10 plus years of training, and I'm interpreting these imaging studies. I thought in many ways I had the answers, and I wasn't sure if a program like this could really do anything. Well, almost immediately we started to see the success of the program. One of the individuals who I'd seen come in and out of the hospital multiple times, we'll call her Abby, was one of the first patients that our paramedics engaged. And after one of her most recent discharges from the hospital for congestive heart failure and COPD, our paramedic went out to her home and performed a visit. And immediately she saw why Abby kept coming back into the hospital. She was a middle-aged woman living with her adult children. She was sleeping on the floor, other adults were smoking constantly in the house. She was subsisting on a diet of mainly canned foods with lots of sodium. She had no access to transportation to get to her primary care visits. It was no wonder why every time we would discharge her from the hospital, a few days later she'd call 911 and come right back. So what our paramedic was able to do was go out there, form a relationship with Abby. She helped her obtain a bed with a back that could elevate to decrease the risk of congestive heart failure, helped organize all of her medications that she would receive from multiple admissions, helped her connect with the local food bank so she could receive healthy, nutritious, low-sodium food to reduce the risk of congestive heart failure, and provided her transportation to her regular doctor's appointments. Instead of rushing her off to the emergency department, she could take her in for a scheduled primary care visit. And then for nearly 2 years, when Abby was engaged with the paramedic, she had no hospital admissions. Incredible increase in the quality of her life and saving our community tens of thousands of dollars that could then be reinvested elsewhere to address other determinants of health. You know, another challenge we face as a community, as does the rest of the nation currently, was around opioids. You know, this is a huge problem. We're in the midst of an opioid epidemic in this country. I remember when we first started meeting that clinical advisory panel, this group of providers with the CCO, a lot of the providers thought, well, you know, there might be a high utilization of brand name drugs. Why don't we take a look at the prescribing habits of our providers and see if there's an opportunity to maybe prescribe more generic drugs. So, you know, we tried to be a data-driven organization, so we pulled some data. And when I got it back, I was absolutely astounded. The top 10 drugs being written for and dispensed for our Medicaid members, they were all opioids. And I thought, oh my gosh, what are we doing? We're literally covering up our community's problems with a narcotic Band-Aid. And so we knew we needed to do something to address this. So we started what was called a persistent pain program. We knew that a number of the individuals who were using these opioids suffered from severe and persistent chronic pain, which is a very complex disease with physical and behavioral, emotional components. And so what this program did was it leveraged existing community resources. It pulled in our behaviorists to start a training program to help educate individuals what were the triggers for chronic pain and how can you manage them. We were able to connect our patients or our members with local Tai Chi and yoga instructors to treat them movement therapy. We formed a small clinical work group composed of physicians and pharmacists and dietitians who would review the medical records of the individuals entering into the persistent pain program to see if there are opportunities to connect them with other resources in the community to manage their pain that they might not be accessing. And so with that, we were able to start to see a decrease in the opioid prescribing in the community. So, you know, what I think those two programs highlight is that, again, a lot of these resources that we were using existed in the community. The food bank was there, the primary care was there, but these resources weren't coordinated. They weren't working together, and it just took a little bit of effort, seemingly on our part, to make those connections by starting some new programs and by getting the input from our local providers and members. So I'm about to finish up here, but in closing, I'd like to say, I think when it comes to the social determinants of health, as a state, we've seen the light, and we truly have a model that is starting to address their importance with our Medicaid population. And with that, I think our communities have become a beacon for hope of what can happen when we give them the permission and the ability to govern their own healthcare resources. So with that, thank you.
Story around community collaboration, and again, being able to do that and then also incorporate multiple aspects of that to help move the needle on healthcare is awesome. So can we please give Dr. Ricketts one more round of applause? Well, I'd like to now take the moment to introduce our keynote speaker. It is an absolute great honor that we have Rich Louv here today. Rich Louv is a journalist and an author of 9 books, including The Last Child in the Woods, Saving Our Children from the Nature Deficit Disorder, which is a very, very compelling, and he'll share with us on that. He also wrote The Nature Principle, and most recently, the Vitamin N, which is the essential guide to nature-rich life, 500 ways to enrich your family's health and happiness. His published work is in 17 countries and has been translated into 27 languages. This helped launch the growing international movement to improve public health by connecting children and their families to nature. As a journalist and a commentator, he has written for the New York Times, the Washington Post, the Times of London, and the Orion. He is co-founder and chairman emeritus of the Children's Nature Network, an organization helping to build international movement to connect people with communities and to the world. He is the recipient of the prestigious Audubon Medal. Prior recipients include Rachel Carson, E.O. Wilson, and President Jimmy Carter. Please welcome Rich Louv.
I need to thank Moda. It's extraordinary that a health insurance company is committed to this issue of connecting people to nature. I hope that this is the beginning of a wave across the country, perhaps around the world, in which insurance companies become leaders in what I've called the new nature movement. Is this on? Is it on now? Can you hear me okay? Because I can't hear me. That truly insurance companies need to be at the table, and this may be a first in which an insurance company, Kaiser has done some good things, but in terms of a regional commitment and in terms of the role of insurance companies in this, I've thought for a long time that both healthcare insurance companies and life insurance companies have a vested interest in this. And we have a lot of great people at the table. And as I say, what I've called the new nature movement, it's also called the Children in Nature movement. But I call it the new nature movement increasingly because it's not just about our kids, it's about all of us. Sometimes when referring to kids, it's called the Leave No Child Inside movement. I should say I have a couple of heroes in the room here. Mike Hauk, where are you, Mike? There he is. Yeah, there he is. When I was writing Last Child in the Woods, and I keep writing about Mike and what he's done in Portland and what an incredible city Portland is and urban region on this issue. And when I learned that Mike was inviting animals into the city and taking people on tours of the nature in the city, that he was really beginning to see what I really believed, which was that wilderness is important, but that urban nature, nearby nature, is just as important. And he told me the story that actually was the seed of a book I'll tell you about in a minute that I'm working on now about the human relationship with animals. He told me, and I talked to him last night about this, and he barely remembered it, but he said that, and this is 13 years ago, I think, or maybe less, that he would walk to work or somewhere every day.
It was the bar.
It was the bar, yeah. I was going to keep that between us, but and every day he would pass a corner and there was a bird that sat on the fence at that corner every day, and it went on. And he said, after a while, I got to know the bird, and the bird became my friend, my pal. I thought that's an amazing story. And that's stuck with me ever since, and I'll tell you why in a second. Tim Beatley is a hero also, because when I was writing Last Child in the Woods, which was the first of these 3 books, and it was published in 2005, when I was in the midst of writing it, I got depressed. When you begin to look at the unparalleled, unprecedented, in human history and prehistory, disconnect between children, which means everybody, because children grow up, and the natural world, just within our lifetime, just within the last few decades, unlike anything
that we have seen as a species in terms of our connection to other life. I didn't see a way out of it. You know, you can only have so many small programs and nature centers. They're extraordinarily important, but it was pretty depressing. And this really hadn't been written about before in a comprehensive way. So I maybe was the first to get this depressed about this issue. And then one day, I don't know where I found it, but I found one of Tim's books. And it was about green cities in Europe. And I began to read it. And I had written a lot about cities before. My first book was in 1984. It was about the future of cities. It was about the emergence of a new kind of city that later became called edge cities, and the rise of private governments and community associations, and how that was changing the urban form. But what Tim wrote about was how cities could, as it's now put, and I think wonderfully, could become a garden. A city can become a garden, not just have a garden in it. And the more I read of what Tim wrote, the more I thought, I've been thinking too small. I'm stuck with this book because I've been thinking too small. I have to go out on a limb with Tim and describe what the future might look like, to make that leap into a kind of idealism that is in short supply, and maybe increasingly short supply. So Tim, he didn't know it, but his book brought me out of that kind of despondent period. And from that point on, I was able to write a more prescriptive book and a more successful book. So thanks, Tim. The other thing that I have to thank you for, you finally convinced me I need to do PowerPoint. And it's taken, I don't do PowerPoint, and it's not because I'm ideologically opposed to PowerPoint. It's because I'm really bad at it. I've done it twice in my life. The first time, everything was wrong, too much stuff on every slide, too much information. It was awful. And I went home and I worked on it and worked on it and worked on it. And I practiced it and practiced. I thought I had a great one. And then I went out and gave a speech to about 500 people. And I practiced so much I didn't even have to look, click, click, talk, click, click. And after quite a while, I noticed they were really looking at my PowerPoint. I said, I've succeeded. You know, I've nailed it, PowerPoint. And then I finally looked behind me, and I realized that my screensaver had gone on. And it was picture after picture of my wife and I on a beach in Mexico. And she looked really good. Me, not so much. So since then, I haven't had the courage to do. This is a true story, I swear. And so, Tim, you finally convinced me. One of the reasons why Tim's images are so important is because I think that we are in what I've, and have been for some time, what I've called a dystopian trance. Over the last more than a decade now, speaking to many types of audiences, I get a lot of feedback. And I've become convinced that most Americans, maybe most people in the Western world, when you ask them to conjure up images of the future, the far future, almost always the images look a lot like Blade Runner, Mad Max, at best the Hunger Games, at least there's a few trees. The kind of hopeful images that you show up there, Tim, we have to show a lot more. Because I'll tell you, they have not entered the mainstream. And we both know that. This dystopian view of the future is like a flame that we are drawn to. Our society is in love with despair. Martin Luther King said and demonstrated in many ways that any movement, any culture will fail if it cannot paint a picture of a future that people will want to go to. Now, we've seen some remarkable images. I don't believe our culture is doing a good job of that, and it's increasingly true. It's not lifting. Despite the images that are available. What happens to a culture when it can no longer conjure up images of a wonderful future, not just a sustainable future? I don't use the word sustainable very much now. I use it sometimes. It's a fine word, but it means too many things to too many people. It's been watered down, but also at the same time narrowed. Most people, when they think about sustainability, think of energy efficiency, and it stops there. If we only have that as a goal, energy efficiency, we'll never even get to energy efficiency. We have to set the bar much higher. I talk to students a lot, and I was at DePaul University, and some students there who were majoring in environmental studies asked me to have some coffee with them. And I got an iWatch for one reason, and one reason only, which is to buzz me when I was going on too long. But the problem is you have to remember to turn it on, which I just did. I was sitting with these students who were great students. They're all environmental studies. They had the Kool-Aid. They were environmental studies students. And one of them said, they had something very specific they wanted to tell me. One of them said that he had tried to join the local environmental organizations. And he said he quit going. I said, why? And these were the local chapters of the big national environmental organizations, 2 or 3 of them. And I said, why? He said 2 reasons. One is they all look like you, old and white. Well, thanks, buddy, about the old part. And, so what's the second reason? He says, every time I go to a meeting, I come away depressed. Young woman sitting across the table from him, very hip young woman. I know that because she had tattoos. And she leaned forward and she said, this is exactly what she said. I'm 20 years old, and all my life I've been told it's too late. And if she repeated it, I'm 20 years old, and all my life I've been told it's too late. And I thought, she's right. That's about the window that journalism and, to a degree, environmentalism have been sending that message, not intentionally, but that's the message that at least gets through. Now, I think there are a lot of young people with hope, a lot of Americans with hope, but not enough. And one reason is because we have drilled into young people that it is too late. Maybe not your kids, but I talk to a lot of college students and high school students, and a lot of them think it's too late. I mentioned the first young man who he said, everybody looks old in the meetings he goes to in environmentalism. They all look like you, old and white. The biggest, I believe, environmental organization in the country is experiencing what many of the large environmental organizations are experiencing. The average age of that, and I don't name it because I don't like to embarrass them, the average age of that environmental national organization is 78 of the membership. It's true. The average young new member is 74. So the old members get together and they haze the new members. And many of the environmental organizations have realized that. They face maybe what newspapers face. They may age out. Now, that's not so true for the local organizations. The land trust organizations are very healthy. There's a lot of health in the environmental movement. And nobody can take anything away from the environmental movement and its achievements. I'm old enough to remember rivers that were on fire when I was in high school that were still on fire when I got out of college. They're now pretty good fisheries, many of them, because of the Clean Water Act. Nobody can take the achievements of environmentalism away. But environmentalism is stuck right now. And many of the leaders of the big organizations understand that. One of the reasons is they haven't recruited kids. They patronized kids for a long time. They treated kids like little messengers that will take recycling home to their parents, get their parents to recycle. They didn't really see them as the future. Since Last Child, in the last decade, that's changed. All of the big environmental organizations, or at least most of them, have really effective programs to connect kids to nature now and their families. So that progress has been made. The good news, though, is that despite the really scary statistics, and I won't go into them in terms of the disconnect between children and nature, and the reasons for that, which include fear of strangers, dominance of electronics in our lives, bad urban design. Parents get lectured, take your kids for a walk. Walk where in many of these neighborhoods? If you're lucky, there's a Starbucks within 2 miles, if that. If you're lucky, there's a lot of green spaces in your community, in your planned neighborhood. Just try to step on them. You know, the CC&Rs, the covenants and restrictions, really narrow the amount of experience. Lawyers narrow the amount of experience that kids and all families have now. If there's one thing that parents and educators fear more than strangers, it's strange lawyers. And I know I got some lawyers in the audience. I've been asking for a while, or suggesting for a while, that we have a national conference on children, nature, and the law. And not just public law, but private law, the community associations, et cetera. That is all true. The disconnect, what I've called nature deficit disorder, which is a tongue-in-cheek phrase at the beginning. Thank God my publisher convinced me against my will to have it on the cover of the book. I'm a hoity-toity journalist. I don't stoop to bumper stickers, I told them. But fortunately, they won. And that phrase has entered many languages. And it unlocks something, I think, that I wasn't planning on, or I didn't know that it would do, which is once parents in particular had a phrase to attach to what they already knew was going on, then they could finally have a conversation about it. Even in the late 80s, when I was researching a book called Childhood's Future, I picked this up from parents, that they thought they knew something profound was changing in the relationship between their children and nature, but they didn't have the words to describe it. So over the last decade, that phrase has taken on a power that I never would have thought it would. The epigram of Last Child in the Woods is from I think a kid, a boy in a classroom I met, who said the reason he preferred playing inside is because that's where all the electrical outlets are. One of the things that I've learned is that the movement that has emerged, that I kind of described at the end of Last Child as, it was wishful thinking. I thought maybe something could occur. That movement has emerged. There are now at least 120 urban regions that have created collaboratives to get kids outdoors and families. There are family nature clubs all over the country now, hundreds of them, that have emerged just in the last few years. What these family nature clubs are parents who decide to band with other parents to get their kids collectively outdoors. They create a list of parents so they can dip into this list, and they can say, I want to go to the park on Saturday. Anybody want to join us? And so you get 3, 4, 5 families at a time going on nature adventures together. What that does is deal with the fear of stranger danger, which is intense among families. I never judge parents for being afraid, because I was afraid too as a parent. My kids did not have the free-range childhood that I did. but I made sure I got them into nature as much as physically possible. Well, these family nature clubs do that. The Family Nature Club in San Diego, the forum just, I think, 4 years ago, now has over 3,000 families in it. Now, they don't all show up at the park at once. But this is a significant thing. This can have an effect on politics, I think, as this emerges, as this grows. In healthcare, of course, there has been a change. In 2010, I was invited, to my surprise, to give the keynote the plenary keynote at the annual conference of the American Academy of Pediatrics. And I faced about, I think, 4,000 or 5,000 pediatricians and pediatric nurse practitioners and other health professionals in pediatrics. I was very scared before I flew up from San Diego to San Francisco for that. First, I was astonished that I'd been asked to talk to all these pediatricians. I mean, nature deficit disorder, really? And my wife is a nurse practitioner. And so she saw that I was nervous. So she took my face in her hands and she said, "Rich, listen to me. Pediatricians are different from other doctors. They're really nice people." Now, I know there are other kind of doctors in the audience here, so just understand this was a device that I used and got on their good side very quickly, the pediatricians. And something happened after that. To my great surprise, a lot of people took it seriously, what I said. One of them was Dr. Robert Zarr. He went back to D.C. He organized the pediatricians in Washington, D.C. To start prescribing, literally prescribing nature. And they didn't stop there. They created a database of all the parks in D.C. so and open space, so the doctor could write the prescription, then turn to the computer and say, "Family, you have a park within a mile and a half of your house, within a block and a half, and here's what you can find there." Portland created a pilot program that I understand now is possibly going to grow into something bigger, which is RX Play. And it began, as I understand it, with physicians writing prescriptions or recommendations to nature here in Portland, working with the Urban Park District, and the family would get home, the Urban Park District, somebody calls the family, says, "Here's what we can do for you. Come to this park on Saturday and get your green exercise." That's now about to, apparently, going to grow into something even larger. Pediatricians take this seriously now. And they have this sense, many of them, of a kind of despair because they see the types of morbidities in young children that have never been seen at such an early age, of obesity, of depression. One of the largest, if not the largest, cohorts of Americans getting prescriptions for antidepressants are young children. They see this stuff, and they don't have the pill to cure what they see. And so they're open to this idea that nature may be part of the solution. A pediatric occupational therapy explained to me later what one of the reasons why pediatricians in particular are open to this. She said pediatricians prescribe pharmaceuticals every day that have never been tested on children. Logically, because you're not supposed to test things on children. So they know there's some wiggle room here. They know that there is an art to medicine in addition to pharmaceuticals and surgeries, etc. But mainly what they feel is frustration that whatever we've been trying to do hasn't been working very well. So some of the leaders of the Children Nature movement now are physicians. We just had our national conference, Children Nature Network, in Oakland a couple weeks ago, and I think there are at least 50 physicians there from all over the country, in fact, around the world. One of the reasons this movement has emerged, I think, is, again, something I didn't realize at the time. I can't think of another issue that will bring people into the same room who don't want to be in the same room. We're out of those topics in America, particularly these days. And yet I've seen it happen over and over again, these regional collaboratives. You'll get conservatives sitting next to liberals, sitting next to pediatricians, sitting next to developers of residential developers, sitting next to other business people, sitting next to conservation leaders, and on and on. You'll get people into the same room who don't really want to talk to each other, and that they usually stay within their silos. This is true not only politically and in terms of religion, but it's true in terms of professions, the silo effect of professions, and even professions within professions staying within their silos and not talking to each other. I can tell you that people care deeply about this issue of connecting kids to nature. Nobody wants to be in the last generation where it's considered normal and expected for kids to go out and lie in the grass in the woods and watch the clouds move. Nobody wants to be in that last generation. When I was a kid, I had many special places in nature, and I imagine that many of you had a special place, or more than one special place, in nature. Maybe it was in your backyard. Maybe you had a tree house or a little fort you built. Maybe it was your garden. Maybe it was the woods. Maybe it was a beach or along a stream where you sat and you watched the frogs pop back up. My special place was I grew up in Kansas City at the edge. My special place was in the field in the woods behind our house. We lived at the edge of suburbia. I can go through my backyard, through the hedge, into a cornfield where my underground fort was, and then from there on into the woods and the fields and the farms that seemed to go on forever. I spent much of my boyhood in those woods on my own with my dog. My dog knew where I was, my parents did not. And when I'd get in trouble, my dog would run back home. And my mother would know something was up because my dog came home without me. But those woods entered my heart as an 8-year-old. I mean, I had such a deep ownership of those woods that as an 8-year-old, I pulled out, I think, hundreds of survey stakes that had something to do, I thought, with the bulldozers that were taking out other woods. I think I held them off for a while. Those were my woods. Now, a few years ago, a residential developer told me, Rich, you would have been a lot more effective if you'd simply moved the stakes around. But the point here is those were my woods. They existed in reality, and they existed already in my heart. And I found something there that was bigger than my parents and my parents' problems, bigger than what I watched on TV. Many of you have that place that you go to in your heart that is still there, even if the bulldozers finally came. It is not guaranteed that the majority of future generations of children, when they grow up, will have that place in their heart that they can go to. I mentioned that that I'm working on this new book, and it deals with an issue that touches health in a really profound way. The new book is about the human relationship with other animals. First, I'll tell you, if I have time, a couple stories. One is, and I promised you that I would tell this story because I teased you with it last night about an octopus. I have a friend who is Paul Dayton, who is a famous oceanographer at Scripps Institution of Oceanography. And he told me a story how, but when he was a younger man, he was on the bottom of the ocean with scuba gear, and he was collecting samples. And he felt something large come over him. He just sensed that something, this is never a good thing. And then he looked up out of the corner of his eyes, and he said it was one of those really big octopuses with a 12-foot wingspan. It was really big. And he said, in his words, it decided that I was a clam. And it came down and it got him. And it wrapped him like this. And he said, Rich, people think that the arms of an octopus are squishy, soft. They're not. They're iron hard and you cannot move them. And the arms of an octopus are really interesting because the arms have what amount to independent brains in them. And not only that, but there's all these photons in the skin, light collecting. So the octopus was holding him and, in a sense, was seeing him with its arms and was thinking about him with its arms. Now, Paul, at that point, realized that he was running out of oxygen. And he could not get away from this thing. And so he did what prey often do. The gazelle in the mouth of the lion relaxes. People who have been in that situation describe, some of them, almost a euphoria. It's a very strange phenomenon if they survive. And so Paul relaxed, and the octopus relaxed just a little bit so that Paul could kick off of the bottom with his feet as hard as he could. And the octopus and Paul started going up and up and up in the water. And as they went up, he felt the octopus's beak, razor-sharp beak at the back of his neck, begin to come around his neck. I love telling this story because I see people squirming all through there. Come around, and pretty soon he was looking at the eye of the octopus, and it pulled back just a little bit. He was looking at both eyes. And he said, at that moment, we made a non-aggression pact. And he says if he told this story at a wildlife biologist or oceanography conference, he'd be kicked out because anthropomorphism is highly frowned on. I actually think it's underrated. So he was looking at this octopus, and then something happened. The octopus let go a little bit more and a little bit more, and then moved away from him. And he said it took on the shape of kind of a space shuttle, and then it began to disappear. And at that moment, Paul hit the surface of the water, rips off his mask, gasping for air. The next part is the amazing part. What does Paul do? He turns around and swims back down after the octopus as far as he could without air, and watched it finally disappear into the dark. I said, Paul, why would you do that? Why would somebody do that after that experience? And he said it was a spiritual experience and he couldn't let go of it. Now, this is a hardcore scientist who doesn't talk about or use words like spirituality very much. But he'd had a connection with that octopus. Now, maybe the octopus had other thoughts, very different, but Paul had this experience. It became a life-changing experience for him. People have this experience in many ways. We have it with our dogs. We have more and more dogs in our cities than ever. One woman in Toronto told me that she came into her living room once, and her 6-year-old was lying next to their dog, whose name was Jack, big dog. They were both lying on their sides, and her son had his arm around Jack. And she heard her son say, "I don't have a heart anymore." And the mother said, she came in, "What do you mean?" And her son said, "My heart is in Jack." That permeability between things that are alive. That's what people experience. They experience it also with wild animals, as well as our pets. And to the degree that cities can begin, as Mike Houck has done, to recognize the children of all animals, the children of all species, not only our own children, and realize the power of that connection. I've been trying to define that, and please don't use the phrase I'm about to use, okay? It'll probably be the title. Seriously, I was on a lake one day in my boat, and I was fishing, and I have an electric trolling motor. On the shore, it was totally deserted. I had the whole lake to myself near San Diego. And on the shore, I saw what I thought were two vultures eating something. So I eased up with the electric trolling motor, and I got closer and closer, and I realized those were not vultures. Those were two really big golden eagles. And I got within 20 feet of them and stayed there for quite a while. You don't get usually within 20 feet of golden eagles. And they were eating the dead carp on the shore. One of the eagles flew up around a mountain peak and then came back down. And they would lean down and they would look at me and lean down and take a bite of the carp and then go like that. And they'd look at me and then they go lean down, and then look at me. This went on for, I think, 20 minutes or maybe more. It felt like a long time. And something happened there. I went home and told my younger son. My younger son, I know knew he had the fishing gene when he was 3 because I caught him fishing in the humidifier. And I told Matthew, who was home from college that day, I said, Matthew, and I told him the story. I said, I don't understand this. I said, but I don't have the words to describe this. But whoever I say I am not. Whoever I was in those moments is who I actually am. This goes beyond human language. There have been some attempts to find a language for this. Martin Buber, the great Jewish intellectual, I often have to be careful not to say Justin Bieber. Martin Buber has a great essay called I Am Thou. And he says basically in this essay what some Buddhists say, others it's not original to him, but basically that you and I don't exist. We don't exist. That what exists is between us. And Martin Buber said that this, to him, was a kind of electricity that exists between two people that some people call God. That's what I felt with the eagles. That's what I think the mother felt, or the son felt with the dog. The permeability of life. That's what Paul felt with the octopus in a very strange way. Healthcare right now is facing one of the biggest problems it's ever faced. You've probably been reading about it. The World Health Organization has talked about it, etc. The epidemic of loneliness. There are studies out now that suggest that loneliness may be about to kill more people than obesity, that it's linked to all kinds of diseases. There's a recent study, very recent, that looked at generational loneliness. It started up here with the greatest generation, baby boomers, Gen X, Gen Y, all the way, millennials, all the way down. What they found was stunning. Each generation that is younger is more lonely. It used to be that older people were thought to be the lonely members of our society. And now the younger people are in America, the more lonely they are. And this, again, is linked to all kinds of health issues. I think a vision of a biophilic or nature-rich society, and I always use the phrase nature-rich, or sometimes do, because you're right. Biophilic is hard to explain. Sometimes it's a stopper. You have to explain it. I use it all the time, much more than I use sustainability. But I hope for a nature-rich society, nature-rich schools, nature-rich neighborhoods, nature-rich cities, a nature-rich future. Remember what Martin Luther King said, that any culture that cannot paint a picture of a world, a future that people will want to go to, will fail. If you talk only about a sustainable future, what are the images that come to your mind? Solar panels and windmills, maybe. And I know it's more complex than that. But what if we began to talk about our cities as biophilic, but in plainer language as nature-filled, nature-rich, that this is a wealth all around us, that cities actually can become engines of biodiversity, not just the destroyers of it. What if we began to talk about that future, a nature-rich future? When I talk to those college students, if I talk to them about sustainability only, their faces are very sincere and earnest. But when I talk to them, when we begin to talk about, well, what would a nature-rich city look like? What would that be like to live in? How about schools that are nature-rich? What would their faces look like this? They kind of come alive. They want to do that. They want to create that future. They want to go to that future. We have to begin to define the future as a beautiful future filled with nature, and not give in to this dystopian trance that we're in. It's not too late. Thanks.
Wow. That was amazing. Let's give Rich Louv another round of applause. I truly hope everyone here this morning has been impacted as I have been. This has been an amazing Moda Minds this year, and I'm really, really thankful and grateful for the speakers that have come and graced us with their wisdom and knowledge. Right now we're going to go and have a break, about 15 to 20 minutes. Housekeeping issue, we're going to have Michael Holden come and give us a 15-minute talk right after the break, and it's fascinating as well. And then we'll have a Q&A discussion. And that will be hosted by Jonathan Nicholas. So there will be 3x5 cards in the lobbies if you have questions of our speakers today, and those will be addressed during the Q&A. Thank you again, and right now we'll stand for break. Applause.